Hello, good morning, everyone. And thank you for those who have been very patient waiting for the past 1 week, but because we tried to do this presentation last week and the gods of technology did not cooperate with us. And luckily, today we are going to be live here as well as streaming. Thank you for being here. This is done under the auspices of VT Seva, volunteering together for Seva or service. It is a little Seva is a little broader than service. Essentially, we service with the attitude that this is an opportunity for us to provide something for someone that is necessary. And there are multiple branches in the United States, and this has been going on for the past 30 years and inspired by Sri Chinnajiya Swami. Well, this is the 29th presentation for VT Seva from VT Seva, New Jersey, being done from Sanjeevani Ashram here in New Jersey. And today I have the distinct pleasure of introducing Dr. Haripriya Vemana, who has been working in this area of cancer research and has both professional as well as personal knowledge about this. And she is going to bring both these experiences together to do the presentation. Thank you.
Thank you. Jai Sri Narayana. Good morning, everyone, and good evening to the folks who are attending from India. My name is Haripriya, and I have a doctorate in pharmaceutical sciences with the concentration in pharmacology. Today I'm going to present about the cancer awareness and prevention. Understand, once someone hears the word cancer, it immediately brings a sense of fear. So today's goal is to remove that fear and remove that anxiety and leave you all with little more information where you are more informed as well as empowered, and also will be proactive to take care of your own self as well as your loved ones around. So, cancer, I mean, many people are dreadful of this word, and few people are even afraid to actually say this word aloud, and they say this is like a big C word, you know. But there is nothing such which we need to be afraid of. Instead, today we will be learning about the awareness and also gaining so much of knowledge, and how that knowledge can help us put behind the fear and help us take care of our own lives. So why are we talking about cancer? Like I mentioned, we all have heard about this cancer either by ourselves or by our loved ones, colleagues, friends, neighbors, and often some of the memories which come here are people going through chemotherapy, treatment, hospital visits, and unfortunately sometimes even death. So although this cancer is being so much rampant, there are much challenges in handling this disease, both emotionally as well as in the treatment wise. So that is the reason we are talking about cancer today, and bringing the awareness and knowledge to you. So like you see on this slide, there are over 1 million cases in both male and female. This is the estimated new cases. The data is from US. However, the estimated rates are decreasing significantly with the increase in the research that is emerging on a daily basis. So before we talk about the prevention and the detection mechanisms, let's understand what is cancer. Our body is made up of trillions of cells, and these cells constantly divide. As seen on the left side, this is a normal cell where the cell divide normally and grow normally whenever it is necessary, and eventually die when there is any damage. But however, in a cancer cell, the cells rapidly multiply in number where it doesn't follow the normal control mechanism. That's where it forms a mass of abnormal dividing cells, and that is often referred as tumor. Now, are all cancer types dangerous? No. Few of the cancer types are benign, and few of them are malignant. A benign cancer is not dangerous, but however, a malignant cancer type is dangerous. So oftentimes we might have heard people referring that, hey, one of my loved one or ourselves got diagnosed with cancer around like stage 0 or stage 1. And few of them say that, hey, unfortunately we got diagnosed at stage 4. So what are actually these stages? So we know from here that a tumor is a mass of abnormally dividing cells. In stage 0, this is just the beginning of the formation of these abnormal dividing cells. And in stage 1, these abnormal cells will be formed, but however, these are in the precancerous stage. And around stage 2 and stage 3 is where the cells will be starting to invade the adjacent tissues. And stage 4 is the drastic one, where the cancerous cell often tend to get transported to the other distant organ. Often this is called as metastasis. So it is very important for us to detect these cancer stages at an early stage. So like I mentioned here, earlier we detect, we can actually take care of that cancer before it gets intense and take over on our bodies. So let's see what are the different types of cancers that we come across. So the most common cancers in men are prostate cancer, lung cancer, and colorectal cancer. And the most common cancers in women are breast cancer, lung cancer, and colorectal cancer. So we often hear from the women around or the men around about the breast cancer and prostate cancer. And the other common ones are lung cancer, colorectal cancer, and skin cancer. Now, skin cancer is caused when we are exposed to the UV rays, and hence wearing the sunscreen is essential for all of us. So I don't want you all to get overwhelmed by seeing all of these cancer types here. Rather, I would want you to question yourself that what is the risk of me being exposed to these kinds of cancers, which we'll be talking in detail in the next slides. So unfortunately, cancer is such a disease where the early signs are not really prominent, but few of the early signs are unexplained weight loss, persistent fatigue, lumps, unusual bleeding, long-lasting cough, which also causes hoarseness. So we have a little acronym here which is called CAUTION-UP, where C stands for change in bowel or bladder, wherever you see a lesion that does not heal, unusual bleeding or discharge, where you can see thickening or lump on your body. Sometimes you also find indigestion or difficulty swallowing, and there are obvious changes in the wart or mole. We all have those warts or moles since our birth, but however, there will be sudden obvious changes in these warts or moles, which are also one of the earliest symptoms of this cancer. There might be nagging cough or persistent hoarseness, unexplained weight loss, and pernicious anemia. So by seeing all of this, one might question that, hey, I'm actually going through three of the symptoms. Do you think that's a cancer symptom? No, not necessarily. Some of these symptoms are also associated with the non-cancerous symptoms, but however, the message here is simply that do not ignore any early signs, whichever it is. It's often better to be get checked early. I hear a few of my friends or colleagues who say that, hey, who intentionally delay their visit to the physician just because they are afraid of seeing something. But I would just want to reiterate that if you make that physician visit, if there is nothing, then you would gain a reassurance. But if there is something, an earlier intervention is always better than the later intervention. So just now we spoke about the early signs. So definitely early detection with the help of these early signs would be helpful. So here we will talk about the screening test. Since we talked about the breast cancer in women, which is more common, mammogram is one such screening test which is commonly used. And colonoscopy is used for as a screening test for treating colon cancer, and pap smear is something which is used for diagnosing the cervical cancer. And often, other than the screening test, since some of these cancers are based on formation of lumps in your own body, which are obvious on the surface of the skin, so often a self-examination by either a male or female on your own body would be helpful, where you would actually find a lump on your body, and immediately you need to consult your physician and then get the appropriate screening test. So here, a few people might argue that, hey, I do not have any early signs or anything, then why do I need to get those screening tests? Exactly, that's the point. We need these screening tests to diagnose whether we have anything when the signs are not visible outside. So this is something similar to the smoke detectors that we have at our homes. We already have them installed. We don't wait for the fire to go up to install those smoke alarms. Instead, we have them installed in our homes where it causes an alarm before the fire blows up our house. Just like that, this screening test would help us in protecting our own lives. So let's see a few of the examples where early detection becomes a critical in diagnosing these cancers. Few of the cancers that can be detected early are cervical cancer and the breast cancer in women and the prostate cancer in men. So cervical cancer prevention can be done by using vaccination, by using the human papillomavirus because it's also caused by that. And the routine pap smear and the HPV testing were also helpful in cervical cancer prevention. Now, not every abnormal pap smear test or the HPV screenings mean that it's a malignant tumor or cancerous in nature. The physician would perform a colposcopy where they would diagnose the cervix in detail and also find those abnormal cells and probably send them for biopsy and then confirm the onset of the cervical cancer. If not, they would prescribe you some medicines where you would be under a normal mainstream treatment. Another screening which is used for prostate cancer is PSA blood test, which is prostate surface antigen. So again, it's not necessary that elevation in the prostate surface antigens are necessary an indication of the prostate cancer screening, but it does indicate that another layer of physician's screening is needed, where a confirmation would be required whether it's a prostate cancer or associated with other localized infections around that prostate cancer. So now this brings us to the discussion of our VP Seva, where they are performing the cancer screening. So VP Seva or Mahila Arogya Vikas is focused on bringing women's health screening access closer to those undeserved human communities in both the Telugu states, Andhra Pradesh and Telangana. Cervical cancer is highly preventable, like I said earlier, when it is observed in the precancerous state and treated early. So screening camps from VP Seva include PAP-based screening, education, a follow-up guidance, medication support, and referrals when needed. So we all have the awareness, but awareness is only powerful when it is put into action, and also when we make these needs accessible to these undeserved communities. So hence, our VP Seva team actually goes to these rural communities and educates the women of the underprivileged communities about this and also educate them about the importance of the screening. And once something is detected, they also follow up with them where the appropriate treatment is provided to them, thereby saving so many lives. Now let's discuss about the genetics. We all talk more and more about genetics in our day-to-day conversations. Like we hear a few of the people around us saying that, hey, there is no cancer. None of our ancestors or anyone I know have cancer in the family. But few of them say that cancer runs in the family. But neither of those statements are actually true. Cancer is not inherited by a single gene. In fact, yes, indeed, genetics can predispose some people to cancer based on the inherited genes where there is a strong family history or cancers at the young age. So few of the genes that are important for the breast cancer are BRCA1 and BRCA2, where these are linked not only to the breast but also ovarian cancer risk. And these genes are also linked to increase the prostate and pancreatic cancer risk. There are other inherited genes such as CDKNA2A, IMAGF, and POT1, which can cause the melanoma or skin cancer. And the BRCA1 or 2 is also involved in the pancreatic cancer disposition genes, along with ATM and CDKNA2A. So here, often these informations are present online. So these days, I find people finding these list of genes and going to a website where they just submit these genes and undergo for genetic testing. But is that right? No. You always have to go for a genetic counseling, a professional help who reviews your pattern, your health history, your family history, and then would suggest to you whether you should consider testing and what screening plan is appropriate for you. So once you know about this from your genetic counselor, you need to question yourself that how often are these genetic testings necessary? Do my other family members need the genetic testing as well? And I would encourage you to consult your genetic counselor regarding those questions. So the risk factors for cancer are both controllable and non-controllable. There are certain things which we can modify, but there are also certain things which we cannot modify. For example, we cannot reverse our age, or we cannot um, reverse or delete the genes that we inherited, or we cannot reverse the radiation exposure we might have gotten exposed in our workplace or something like that. But however, the environmental factors where we can place ourselves in and the lifestyle choices can definitely help us in minimizing cancer, where following the healthy lifestyle would also involve taking good diet, avoiding alcohol, avoiding smoking, the tobacco, and being active, regularly exercising and having good workout, and taking care of the stress. I know it's difficult to lead a stress-free life, but let's all pledge together to reduce our stress a little bit from what we go through regularly. So with all these, the prevention is definitely possible by detecting the cancer early in the stage and also by following the healthy lifestyle where that plays a major role. Here, I'm not asking you to transform your life overnight. It's just following those minimal practices and following it on a daily basis where you take those small actions for a longer period of time and be physically active, get the exercise, maybe get an extra 30 minutes of walk or something like that. And for example, regular screenings. I know few of you might have kept the colonoscopy or the mammogram on hold, so maybe you can invest your time in getting that mammogram done or colonoscopy done or schedule that visit with the physician this week. And since the UV rays are also responsible for causing the um, skin cancer, a safe sun practice is needed where you have to wear the sunscreen when you're exposed to sun, as well as in addition to avoiding tobacco and alcohol, as I mentioned earlier. So prevention is possible, and we need to make it part of our regular daily lifestyle. So now the cancer is detected early. Let's say in the case that we went to the screenings, we got diagnosed with cancer. So what are the treatment approaches then? So the treatment approaches are surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, and combination therapy. Sounds like there are too many therapies, right? So what is surgery? Surgery is often performed when it is diagnosed at the very early stage, where you can remove the tumor from that particular environment. And chemotherapy is the place where drugs are given to inhibit or kill the cells in that particular tumor. And radiation therapy is where the radiation is induced in the targeted tumor region. And targeted therapy is the therapy which involves using the molecular structure of the tumors. And immunotherapy is basically training your own immune system to go and attack those tumor cells and eliminate them. And combination therapy is often used as an effective treatment where we use a combination of one of the above listed therapies. So among all of these therapies, These days, the personalized therapies are being used very much. So you might find two people with the same cancer type. Let's say person A might be getting the treatment for the lung cancer, as well as the person B is also getting the same treatment. But however, the treatment regimen used for both of those individuals will be different because the molecular characteristics of the tumor found in each individual would be different, and also the detection from which the cancer stage is located is also will be different. So no two therapies are same, and hence the personalized cancer treatments are emerging in the current day and age. So we have seen that there are so many treatments available for cancer, but however, unfortunately, for few of the advanced cancers, some of the treatments which we just discussed are not amenable for curing the tumor. So in these cases, the focus shifts from cure to comfort and giving that dignity and quality of life. So here, when no medicine is used for treating the aggressive cancer, it doesn't mean that it's giving up. It is still an active care where medical professionals are involved. So the palliative care is involved in symptom management, providing the emotional support, which improves the quality of life and also puts them in the spiritual care with the family support. So the goal of this palliative care is the mitigation of the pain and symptoms which are observed, and to give them some relief from breathlessness, nausea, constipation, fatigue, and oftentimes they also have sleep issues. So helping them get some sleep will always help, and monitoring their nutrition, and oftentimes they are immobilized. So a caregiver support and helping them mobilize around will also help them. And giving that emotional support, family and spiritual care will play a major role. And in certain cases, a palliative radiation or procedures are also performed where it can mitigate those aggressive side effects that the person is going on. So hospice or the end of the life care is which is where the comfort is the main goal in this palliative care. So there is dignity in choosing the treatment where um, the treatment would be working on that particular type of cancer when it is diagnosed. But there is also dignity in choosing that comfort when the burdens of active treatment is actually greater than the expected outcome. So in such cases, the palliative care is really important and helpful. So cancer is not just about diagnosis, screening, or treatments, but it is above and beyond that. It involves real people, real emotions. So it does take so much of mental and emotional toll. For the patient himself or herself, it will be a shock and fear, loss of control. They might see changes in their physical body, and they might lose their identity, which in turn causes anxiety and depression, and probably they might even isolate themselves. And for caregivers, such as often spouses or doctors or sons or anyone who have played those roles till the end, would shift their care and also play a role as a caregiver where they deal with hospital appointments, treatments, transportation, nutrition, and everything, which again gives them immense emotional stress because of these role changes, causes financial burden, which causes burnout. And oftentimes these situations keep them in an uncertain situations where they do not know what would happen, what do we tell to our family, or what can we say to our children, how would our future be. So there is so much of shared impact where there is uncertainty about future, strained relationships, and oftentimes in these situations, people find themselves having these existential questioning, especially for those who are in the spiritual path. So, since it takes a lot of emotional and mental toll on the body, if you know anyone around you who is suffering, you know, a simple "Hey, I'm here for you" would mean a lot for people who are going through this. So, hence, emotional wellness is also part of the cancer care along with those treatments, where the emotional wellness include practicing yoga, doing that meditation, where the mind and body would align with each other, and sleep is definitely helpful, where that perfect minimal rest should be required for a person to recover. And as I mentioned earlier, an emotional support would definitely mean a lot. Oftentimes, we find people distancing themselves or disappearing or isolating from their regular social circle. But these are the times when the social circle should step in and actually be there for them and offer that emotional support. So here, along with the emotional wellness, when someone is being taken care emotionally, definitely that would build hope. So hope leads to recovery and ultimately leads to the well-being of that particular person. So among all of this, there is an entire family and community that is used that plays a major role, and there are many caregivers and support groups. And the support groups not only exist for the patient, but also the support groups are essential for the caregivers. There are counseling services where they instill the confidence and the strength in them to overcome these dire situations. And oftentimes it is very important to be misguided because there is so much of misinformation online about this cancer, unfortunately, where you might find some dramatic websites or the post saying that this is like the magical food, or you can stop chemotherapy, or do not discuss with your doctor, do not fall for that. There are some reliable online resources, which is World Health Organization and American Cancer Society, and there are other reliable online resources. A approach to a professional who actually are in that field would know the actual information rather than falling for the misinformation that is available online. And there is an immense hope through research. Being a scientist, I know how a drug goes from bench to bedside. And right now, there is a new era of personalized cancer vaccines which is going on. Just 10 days ago, Moderna, we all know Moderna, which is known for the COVID vaccine, which is of mRNA type. So this Moderna actually entered into a phase 3 trial, they announced it on August 19th, where they use the same COVID vaccine, the mRNA type, for treating the melanoma along with the Keytruda. So here the concept is they create the fingerprints and train the body to detect those mutations whenever it reappears, and also remove the brakes off from the immune system, where the immune system goes to those fingerprints and eliminate those remnants of the cancer cells which might be present. So there is immense research that is happening across the world, and that is the reason although the estimated new cases every year are increasing, the estimated new deaths are decreasing at a significant number. So up until now, we talked about diagnosis, screening, emotional wellness, and everything. But cancer is not only committed to that diagnosis report, but it is above and beyond. Like I mentioned earlier, it involves real people, real emotions. So often, these sharing the patient stories has immense emotional power where the page and when one patient shares these stories with another patient, it creates a connection where the patient would feel less alone in their cancer journey. Immediately it instills confidence where the real life experiences would actually empower the patient to ask more questions and also make them more informed about their decisions and how to go about their treatment strategies. I think the major thing is the hope. Perhaps that's an immense indicator for a person who is going through the chemotherapy or any cancer treatment. Uh, Sharing the patient stories also offers hope. Basically, hearing how others face these challenges brings hope for their own future. And often this also encourages empathy, where these stories help not only the families but also friends and the healthcare teams understand actually what the patients go through, and it's not just about the treatment. Thereby, it strengthens the communities where the sharing stories creates a culture of support, compassion, and also gives that immense strength. And further, ultimately, it helps to create a change where patient stories will help in raising awareness and inspire better care, know the policies, and also obtain the actual support. So, sharing these patient stories, um, there is a lot of emotional power, and every story matters, every voice counts, and every story can change the cancer care for the better. So, if you know of any other patient stories, do share with your loved ones when they are going through these situations. So, what are the key takeaways from today's presentation? Yes, cancer is not only something which we need to be afraid of or be fearful of, but there is so much of awareness and knowledge which is available where when detected early and prevention is possible. Early detection does save lives, and we also talked about how our BT Seva is playing a major role in helping these cervical cancer, breast cancer to be detected early in the rural communities. And healthy lifestyle definitely improves the wellness. It's not something which is a perfect lifestyle care. Rather, incorporating those little changes in our lifestyle and diet would go a long way. And for people who are suffering with advanced cancer, there is definitely palliative care which is available and which is more powerful. And with all of these, certainly we can fight cancer. So basic three things are: one needs to know your body, know our body, and also know our risks. So based on the screening or the information that we obtain, one can estimate the risks, and immediately I would suggest you to book that appointment for those screenings. So know your body, know your risk, and get those appropriate screenings done. So now that we have discussed about these cancer lifestyle changes or the early detection mechanisms or um, screening techniques, so I would ask you to let's have this interaction session. For those who are attending online, you can use the comment box to have your answers written. So, do you think can cancer really be prevented?
Um, no, we don't have responses here.
Yes, cancer can really be prevented when we detect it early at an early stage. And for the next question, what are the most important screenings I should get? So from our earlier slides, the most important screenings one should get are uh, mammogram, colonoscopy, and for the women it's the pap smear test. So if no one in my family has had cancer, are you safe?
No.
No. Like I said earlier, cancer is not just based on one single inherited gene. Rather, many other risk factors are also involved. Does stress cause cancer?
Contributes to.
Yes. Stress doesn't directly cause cancer, but yes, it does contribute to cancer where it might weaken our immune system. What diet is best to reduce cancer risk? A healthy balanced diet. We don't need any miracle food or that magical potion to cure our cancer, but a regular balanced diet which is rich in fruits, legumes, greens, leafy vegetables, and all would help us reduce the cancer risk. If I feel fine, why should I get screened? So this is often the question which I hear from my loved ones as well.
To catch something early before it is symptomatic.
Correct. So these screening methods are used to catch something very early before it gets symptomatic, and early prevention definitely helps us in um, diagnosing the cancer at an early stage and following the appropriate treatments. How can I support a friend or family member with cancer?
Show them that you are there.
Yes. A simple hi, hello, even though they distance themselves. being there for them would mean a lot. And maybe you can just pick your phone and call that friend or a family member today. So here I would want you all to reflect on one thing. What is one small action that you can take this week to reduce your cancer risk or support someone else? So one action would be there. One action that you can take to reduce your cancer risk is, first of all, pay the doctor visit. Do not delay the physicals, which I know many of you are delaying it. And coming to the supporting someone else, just pick your phone and give that call to your loved ones. So these are the references. All the information which is presented are obtained from reliable official sources. And with this, I would want to end this talk by I'm hoping that all of you had this information and knowledge helped you to put that fear behind and gain some knowledge. So, three things: know your body, know your risk, and get those appropriate screenings. And also make sure that you are checking on your loved ones as well. So with this, I'll end this talk. This is an educational discussion only, and if you have any other questions or concerns related to your health, immediately get that appointment scheduled with your physician and get those individual screenings done. Together, let's beat cancer. Thank you.